fueron apropiados de manera ilegal por otro país, simplemente porque el otro país era más grande y más poderoso. Asimismo, en esta circunstancia en la que el mundo ya cuenta con una vacuna, los países ricos están acaparando las dosis suficientes de vacunas contra el coronavirus para vacunar casi 3 veces a toda su población. Es decir, existen países que acopian la vacuna incluso con mucho más de lo que necesitan para vacunar a la totalidad de su población. Está el caso de un país de nuestro propio continente, un poco más al norte, que ha acumulado 9 veces el número de sus ciudadanos en número de vacunas. En tanto, la inmensa mayoría de los países no ha podido vacunar a ni una sola persona desde que la vacuna. ¿Quién decide dónde va la vacuna? Y esta es una absolutamente incontrastable de cómo funciona el neoliberalismo. La vacuna, es decir, es el mercado el que está decidiendo quién se vacuna primero. Quien paga más se vacuna antes. Se vacunan primero los más ricos, se vacuna quien puede pagarla. Y con todo lo que toca el neoliberalismo, porque lo convierte en una mercancía que está sujeta a ver quién tiene más dinero. En esta crisis, para resolverla, ¿a quién miramos? Miramos al Estado y miramos al multilateralismo como los mecanismos para paliar esta gravísima situación. Pero lamentablemente el multilateralismo no solamente está en crisis, sino está bajo una permanente amenaza. Una amenaza que intenta, por supuesto, su destrucción. ¿Acaso no son los mismos países que acumulan las vacunas los que atacan a la Organización Mundial de la Salud? ¿Los que se desasocian de la Organización Mundial de la Salud? Entonces, no es la mano invisible del mercado la que va a resolver estos temas. Solamente un Estado fuerte, un sistema multilateral fortalecido, con servicios públicos entendidos como derechos humanos. Pero en medio de este panorama tan desalentador, se perfila la esperanza. En este mismo instante, en decenas de países alrededor del mundo, los trabajadores de la salud cubanos están en la primera línea de combate contra la pandemia. Pese al bloqueo despiadado, a ese bloqueo económico, financiero y comercial. Y lo mismo, en lo que va de este año, la República Bolivariana de Venezuela ha dado un ejemplo clarísimo de cómo deberían ser las relaciones entre los pueblos. Ha enviado oxígeno, ha enviado médicos al estado de Manaus, a la ciudad de Manaus en Brasil. Esos son los ejemplos que la humanidad debe seguir si es que en verdad queremos resolver esta gravísima situación. En ese marco, y perdonen por la extensión de mi intervención, creo que la responsabilidad de nuestra alianza tiene que sentar un ejemplo de cómo se deben conducir las relaciones internacionales para enfrentar una amenaza en común. Estoy convencido de que los resultados de esta reunión nos llevarán en ese camino y será un acicate, no solamente para los países miembros del Alba TCP, sino para la humanidad en su conjunto. Dicho esto, me permito dar inicio a la reunión anunciando en primera instancia que después de cada una de las delegaciones hará una importantísima, y les pido la mayor de las atenciones, una importantísima intervención nuestro presidente ejecutivo del Banco del Alba, Su Excelencia Raúl Licausi, con algunos anuncios muy importantes que tienen que ver con lo que nos reúne hoy en esta sesión especial del Consejo Social del Alba TCP. Sin más, me permito ofrecerle la palabra a Su Excelencia el doctor Carlos Alvarado, Ministro de Salud de la República Bolivariana de Venezuela. Excelencia, tiene la palabra.
Muchas gracias, señor Sacha. Voy a permitirme retirar la mascarilla, este necesario e imprescindible instrumento para la prevención de esta terrible enfermedad. Quiero extenderle un caluroso y afectuoso saludo y un abrazo virtual a todas y a todos los que nos escuchan, los ministros, ministras y los diferentes voceros de los países del ALBA, de parte de nuestro presidente Nicolás Maduro, nuestra vicepresidenta Delcy Rodríguez, nuestro canciller Jorge Arriaza y de todo el pueblo venezolano. En estos minutos, pocos minutos que me corresponde, voy a compartir con ustedes la situación del COVID en la República Bolivariana de Venezuela y la manera como lo hemos ido abordando. Para el día de ayer, 18, en Venezuela llegamos a 120.444 casos confirmados de COVID en Venezuela. Estos 120.444 casos confirmados desde que comienza la pandemia, el 93% de ellos han tenido formas asintomáticas o leves de la enfermedad y el 7% formas moderadas y graves. Lamentablemente hemos reportado 1.112 fallecidos en lo que va de pandemia, lo que representa una letalidad de 0,92%, que aunque es baja en relación con otros países, para nosotros sigue siendo un desafío muy importante y nos lo ha señalado el presidente Maduro en muchas oportunidades. El 55% de los casos ha sido en hombres y el 45% en mujeres. El porcentaje más alto de casos, el 78%, entre 20 y 59 años de edad. Nosotros tenemos actualmente 17 casos por cada 100.000 habitantes, 17 casos activos por cada 100.000 habitantes, y venimos de un comportamiento que venía en descenso a finales del año 2020, y luego a partir de la tercera semana de diciembre hemos comenzado un incremento lento y sostenido de casos que nos ha puesto en alerta una vez más para contener y evitar que esta situación se siga prolongando en las próximas semanas, y hemos, retomado nuevas actividades con muchísimas más fuerza. En Venezuela el abordaje de la pandemia se ha hecho en 5 fases fundamentales. La primera de ellas fue una fase preparatoria que comenzó en enero y terminó en el mes de marzo, cuando el 13 de marzo del 2020 aparecen los 2 primeros casos de COVID en Venezuela. Inmediatamente después comienza una fase de cuarentena radical que se extendió hasta el mes de junio. A partir del mes de junio comienza una etapa de flexibilización progresiva que se ve interrumpido por una cuarta fase no esperada por nosotros, que fue una fase de finales de junio donde hubo un retorno masivo de miles de venezolanos que habían ido a otros países y por el manejo, y por la atención inadecuada que recibieron en esos países, pues retornaron a nuestro país por vía Colombia, por vía Brasil, procedentes de Ecuador, de Perú y de otros países de América Latina. Con esta gran oleada de personas que regresaron de otros países, pues Venezuela comenzó un incremento progresivo de los casos durante los meses de julio, agosto y septiembre. Y luego comienza la reducción del que le hablé previamente. Ya para los meses de septiembre comenzamos con una fase de flexibilización controlada. Venezuela experimentó y propuso el presidente Nicolás Maduro el modelo 7+7, que no es otra cosa que combinar la cuarentena radical, 7 días, con una flexibilización controlada 7 días, de tal manera de permitir un mejor control de la pandemia, y así hemos logrado un mejor manejo de la situación a nivel nacional. Podemos afirmar que las claves que nosotros del éxito del manejo en Venezuela de la COVID tiene que ver con los siguientes puntos. En primer lugar, la preparación temprana que acabamos de mencionar. En segundo lugar, la creación del Consejo Presidencial para la Prevención y Atención de COVID. Desde el mes de febrero se viene reuniendo diariamente.
Or the vice president, the executive vice president Bolivia, in order to correct all the measures that have been taken so far. We have made very drastic and swift measures. Venezuela is the first country in Latin America that will demand that the population to permanently wear the masks in all cases, and also the radical quarantine and the suspension of activities. Ever since the first cases, we took those measures. And also, we have the participation and cooperation of China with the international protocols that allowed us to attend to the cases that appeared at the beginning. We also created hospitals where we concentrated all the doctor personnel and medical staff in order to attend to the severe and COVID patients. We also made arrangements with the hotels in order to increase the number of rooms for patients that require to be in quarantine. We also delivered free of cost treatment in order to address the COVID-19. We used prophylactic goods and also treatment for more severe disease ill. We have 4 kinds of treatment for our patients. We use the technological platform Patria, and we make digital or virtual verifications, and people can be reported being ill. And then we have different teams that run door to door in order to search the people that are calling deal with COVID-19. We created also in our borders the social attention centers and the social control points in the border in order to attend to the COVID-19 cases. And of course, in that we received extraordinary international cooperation thanks to the international mutualism like FACO, like the United Nations system, and also other countries such as China and Cuba. So these have been the most important ingredients or secret in controlling the pandemic in 2020. Now, challenges for 2021. First of all, more research on this disease. This is a disease that even if it appeared 1 year ago, there are still many doubts in terms of its evolution, how it behaves in the human body, and all the post-COVID syndrome that is being reported in the scientific research. And also, we have also been working with the new treatments that need to be identified in order to address the pandemic. And also, we need to work with the post-pandemic immunity, which is one of the important elements in order to address properly the pandemic, as well as all the mechanisms in order to live with quarantine. So these are issues that we have been facing. One of the most important things that was mentioned by Sacha minutes ago is the vaccination issue. 2020 is the year of the COVID immunization, and we have seen a terrible warfare for the vaccine, which is unequal and which may complicated the access to the less powerful countries. Among the very important challenges we have also the economic relaunching due to the first outbreaks and the outbreaks that followed. are in quarantine, and economy is still a problem. Venezuela and Cuba have faced the very important challenge of surpassing or overcoming the blockade. Venezuela has a lot of resources, more than $30 billion to have been received international banks, and these resources could be used to control the pandemic in Venezuela and the world. But due to the blockade imposed by the U.S. government and their allies, we cannot use these resources, not even in order to buy vaccines, as we have asked many times in the past. It is very important for us to share with you not only the challenges, but also to know what you're doing in your countries, what protocols you are putting in place, what you are doing in order to address this problem, so that we can help each other as it is enshrined in the Constitution of this extraordinary regional block of integration. And in that way, we aim at overcoming not only the health problems, but also social problems. Thank you very much. I thank His Excellency Carlos Alvarado, the Minister of Health of Venezuela, for his speech. Now I'll give the floor to Vice Minister Miriam Alquiza Santana of the Higher Education Ministry, who is going to make her intervention, and then we will give the floor to Luis Martins, who is the scientific advisor of the President of the Cuba Pharma, and also to Vice Minister Angulo, who's also going to take the floor. So we will give the floor to the Cuban delegation. Good afternoon. I will now take the floor as the representative of the Higher Education Ministry and coordinator of Social Council of Alba. With me here today, the Vice Minister Rogelio Sierra, Vice Minister Nelia Angulo of the Public Ministry, and Luis Romero, advisor of the Cuba Pharma in Cuba, and also other colleagues who are with us. We would like to thank the Bolivarian Republic of Venezuela and the Alba TCP for the initiatives and the opportunities that has been given to us to participate in the Social Council under the slogan United Against COVID and the Digital Illness. Ever since the first wave of 2020, we identified the first outbreak of a new virus, and the WHO declared COVID as a pandemic. Ever since, countries have made measures in order to stop the pandemic. We need more than ever the solidarity in order to share good practices. And united, we are going to fight against COVID. We require a dynamic, efficient, and comprehensive response to COVID-19. Complementarity and participation of our country. One of the most important dangers of COVID is not only the impact it has on human life, is also in the learning, more marginalization and exclusion of the youth and the access to education. We have seen how the attacks of the United States have increased in order to hamper the economic development of Cuba. And they have also added new measures to the blockade. The coronavirus is a challenge in the midst of the crisis imposed by the blockade. We reiterate our commitment in facing COVID-19, particularly for the exchange of science scientific information among countries of TCP, Alba TCP. I will now give the floor to Dr. Angulo so that she can talk about the situation of the pandemic in our country. In order to close our intervention, Dr. Luis Herrera, who is going to tell you about medicine, treatments, and the science advances so far, and all the research that has been conducted by our scientists. COVID has put under a lot of pressure the world's capability. In Cuba, before the detection of the first cases, we had already designed the national plan that was approved with an intersectorial character and that was adapted to all territories. We set up a work team led by the president, Diaz-Canel, who has been daily controlling the situation in our country. And ever since they started working, we have adopted the necessary measures to stop the pandemic, and we have put in practice also the best experiences in order to address those very complex sanitary problems. The capabilities in terms of infrastructure, organization, and human capital have been very important, and also with the support and the provision of the pharmaceutical medical equipment from Cuba. We developed 29 products based in immunomodulators, antivirals, anti-inflammatories, vaccines, and medical equipment. Ladies and gentlemen, in our sanitary administration, we have been successful in working with the different sectors in order to prevent the infections, the swift way in which we have made decisions, the individualized treatment of patients, and the following up of those in convalescence that are in the communities. This, along with the science and innovation, has enabled to set up the Cuban protocol in order to handle the disease, comprising the mental health. And so far, 91.3% of cases have been recovered. And thanks to our work, our health public system has not collapsed. We do not have any girls or boys or children deaths, and we have not had so far maternal disease rate. We have based our actions on solidarity. 57 brigades have cooperated in combating the pandemic in 40 countries by request of different governments. And we also have been cooperated in 59 countries to which we have given our solidarity in spite of the unfair blockade imposed by the U.S. administration and all their attempts to sack the cooperation. We would like to reiterate our commitment to continue sharing the health services. So from these initiatives, cooperation and solidarity, we will be able to help preventing this terrible crisis and save humanity. Thank you very much. You have the floor, sir. Executive Secretary of Alba TCP, the representative of the Bolivarian Republic of Venezuela. I would like to thank you for the opportunity, and other members of the Social Council, Alba TCP. As it was said by our president on December the 14th and 18th, the virtual meeting of Alba TCP, and I quote, "In the midst of a complex international situation, in spite of the U.S. campaign against medical cooperation that Cuba is offering, and in spite of the recrudescence of the economic blockade, we have demonstrated once again that internationalism and cooperation are the most effective tools to combat the pandemic. And Cuba reiterates its disposition to enlarging cooperation in public health, public sectors with the countries of Alba TCP that is going to be based on the exchange of experiences and scientific advisory in order to face COVID-19. In our country, we have attained favorable results adopting an approach that includes many aspects, and we are willing to share this with other countries of the alliance. In an article that was published by Dr. Manzi, and I quote, one component of this strategy is the Cuban pharmaceutical industry. We guaranteed medicines according to the protocol of the Ministry of Health, and there were many products that were used in combating COVID-19. Biopharmaceuticals, Mobilina T, and other strains have been used to prevent the infection produced by the SARS-CoV virus. Aferon was given as an antiviral treatment, and Yusuvin and Cyclosanab were used to stop the hyperinflation reaction. The products of biotechnology have contributed to diminishing the critical cases and the reduction in mortality in 10 times. There are also other pharmaceutical antiviral products that have been used, products of a natural origin, and also medical equipment. We have been doing this in different phases, and the 4 candidates of vaccine being developed in the COVID in our island. We have an important know-how and infrastructure. The candidates are Sovereigns 01 and 02. The first candidate is culminated the phase 1, and Sovereign 2, the second candidate for the vaccine, is the only candidate that is combining Sovereign 2 and 1. We started phase 2B of our clinic essays. The other 2 candidates come from the Engineering Center of Cuba, Mambisa y Abda, and they are concluding phase 1, and Mambisa, who is having better results. Thank you very much. Thank you to the distinguished representatives of the Sicily nation of Cuba. I would like to take the opportunity to greet Vice Minister Sierra, who was with them. And I will now give the floor to Marta Reyes. She's the Minister of Health of the Republic of Nicaragua. Good afternoon. Greetings from our government of national unity. It is important for us to participate in this meeting, and there is a very special topic that has to do with COVID and the way in which we are addressing the pandemic COVID-19. I would like to say the following. From January, the Reconciliation and National Unity Government perceived health as a human right. In order to make it real, we have been promoting the communitary health program. which gives priority to prevention of diseases. We have strengthened our hospitals and health centers with new structures and new equipment. We have been closely working with the communities through health fairs, mobile clinics, and different strategies that have been implemented within the communities. The main focus is families who are integrated in different programs with community leaders. We can see this in the anti-epidemiological fight that we have been developing through vaccination in a systematic way, the quality of the services, among others. Within the framework of this health program, we have been developing the following actions to address the COVID-19 pandemic. Following the orders of the President of the Republic, Daniel Ortega, and the Vice President, Madame Morillo, since January 2020, we set up the Interinstitutional Commission in order to strengthen vigilance at the borders. The very same day, the WHO declared the pandemic, and we have put in place preparation protocols and response protocols that we are updating following the directives of the WHO. We are taking care of our patients according to their needs. We have ventilators, we have equipment, different kinds of equipment to monitor vital signs, and to put PPE for our workers. In our health centers, we have organized our efforts for early detection and transfer to the patients to hospitals. We are using PCR in real time, PCR tests, which is the test recognized by PAHO and WHO. To those entering the country, we are measuring the fever and conducting inquiries and also providing treatment. And we have followed more than 70,000 travelers. Whenever there is a positive case, we search the people they have been in contact with, and we administrate medication. Within the framework of this program, we visit houses door to door, looking for patients that could be identified. We have the medical equipment, medical inputs, ventilators, and other equipment to address the cases, and we have also made purchases to increase this input. We have been conducting also an intensive measure of prevention protocols with the participation of the communities. We have trained the workers, health workers in the private and public sector. We have been identifying possible cases, providing medical care, and taking patients to the different hospitals according to availability. We have trained 250,000 members of the community leaders who work in different organizations in terms of prevention. So early detection and the reference of cases to our hospitals. We are constantly spreading messages regarding the importance of early detection of COVID-19 in the midst of universities, schools, churches, markets, bus stations, so on and so forth. We have also met with the teachers, the young, in order to inform them on the work situation and to guide them the necessary measures to be taken. We continuously exchange with experts in China, Taiwan, Korea, India, and other countries, as well with international experts of PAHO, WHO, and the Henry Reed Cuban Brigade on the way to prevent COVID-19. We held meetings with the diplomatic corps and the cooperation agencies to inform them on the different measures that have been put in place in preparing our response to COVID-19. We belong to the contingency regional plan with the Dominican Republic to give a common response to COVID-19. On a weekly basis, we brief the population through the different media about the behavior of this illness nationwide and how to take preventive measures. So this is what we have been doing since 2020, and we are continuing with those practices in 2021. Thank you very much. I'd like to thank Marta Reyes, the Minister of Health in Nicaragua, for her explanation, very clear explanation. I will give the floor now to His Excellency Jason Marcos Sousa, Minister of Health of the Plurinational State of Bolivia. You have the floor. Good afternoon, brothers and sisters. It is for us an honor to participate in the different meetings of Alba TCP. As you know, Bolivia has been isolated by the de facto government that did not have the legitimacy of the Bolivian people. And we see this as an opportunity to strengthen the bonds of solidarity that unite us with our countries. And I would like now to present the Minister of Health that has been recently appointed, Mr. Jason Angel Sousa. Good afternoon. Thank you very much. Special greetings to our friend Sasha Llorenti, Executive Secretary of Alba TCP, and greetings to all the countries and authorities that are participating in this very important meeting. COVID-19 in Bolivia has unleashed the alert, and of course we have been taking measures in order to face the consequences and challenges posed by this disease. Bolivia was one of the last countries in the region to have confirmed cases of coronavirus. Since March the 11th, we identified 2 cases in our country, and the government that was in place was a de facto government that was not elected by the popular vote, and that was supposed to convene elections as soon as possible, but was their main task. But that transitional government decided to implement a rigid quarantine to buy medical inputs, tests, etc. These objectives were not attained. On the contrary, they were used as an excuse to a mismanagement of the government's resources. Our government is working very hard in the negotiation to purchase medicines, vaccines, and tests to combat COVID-19. In order to improve the facilities and clinics and hospitals, and also we have not foreseen to go back to a quarantine, because the most affected were the dispossessed, the poorest. 80% of the Bolivian population exerts an informal activity. So if we just implement a quarantine, a rigid quarantine, we would be impacting on the whole of the population of our country. This is not a foreseeable practice. For the second surge outbreak, Bolivia was declared in an emergency in terms of access to medicines and vaccines. The figures that we have so far of COVID-19 are the following. We have new cases of 10,550 cases, for a total of 108,000 cases. And we have recovered 145,000 cases. And we have 4,200 active cases, and unfortunately 9,700 deaths. We consider that one of the elements that we need to factor in when combating COVID-19 is universal access to diagnosis, treatment, medicine, and the structural response to COVID-19 would be the vaccine. For us, this is a priority. Combating COVID-19 is a priority, and also for the rest of the world. We need to intensify the search and make it possible for all those who need the vaccine will be granted access to it, as well as to other medicines that will combat COVID-19. We also need to put in place good practices, an exchange of good practices of COVID-19. Vaccines are very important indeed, because it's the way in which one can prevent the disease. So this is why we consider that the vaccine is going to be the ultimate solution. In Bolivia, we will administer the vaccine in a free manner. And so far, we have concluded contracts to purchase the Sputnik 5 vaccine, which has an effectivity of more than 85%, 95%. And those vaccines will arrive in January and February and are going to be administered to those who are in the front line. And also we will purchase other vaccines until we have completed the 5.2 million doses in May 2021 that will enable us to vaccinate the 2.2 million Bolivians. And to obtain the AstraZeneca vaccine, which has an effectivity of 90%, we will receive 1 million doses in April, and May 1.6 million, June 1.2 million, and July 1.2 million doses, which will enable us to vaccinate the 2.5 million Bolivians. And in order to face the second surge of the pandemic, we will resort to transparency in our mass media. And yesterday, we presented the different informational tools, a program known as United Against COVID-19, in order to disseminate the necessary information in this period that is creating some concern within the Bolivian family. There is also one application that can be downloaded into your mobile phone. It is named Secure Bolivia, which enables us to identify the pharmacies, drugstores, hospitals, as well as the crisis of medicines. We have also created the website boliviasegura.com, which briefs the population on what is happening in our country. We have a green line, a free line, telephone line that gives information 24/7, providing not only medical care online, but also the use of traditional medicine that is a common practice in our country. We have also launched a review named Traditional Medicine, which comprises all the knowledges that have been practiced for ages by the indigenous population using spiritual and natural resources that help in preventing the disease. The government also approved the decision 4451 establishing the new guidelines in order to stop coronavirus surges. The vaccine distribution is going to be placed under the responsibility of regional governments, and the mandatory use of masks, water sanitation, social distancing, and some of the aspects that we could mention of this decision 4451 are the following. The IED's expedition in a manner to avoid crowding. The assistance to the population 1 or 2 days per week according to the organization. And also the suspension of social activities in order to avoid crowding and sport activities and religious practices in closed spaces. So we have put in place all these biosecurity measures ordered by the ministry, which are to be implemented in all different public organizations. Among the most important aspects that are established in this decision 4451. Thank you very much. Thank you very much to the Minister of Health and Sport of the Plurinational State of Bolivia. Greetings to Benjamin Blanco, Deputy Minister of Foreign Trade, and best wishes for the success in all your activities.
Now I recognize Dr. Lawrence Spirit, Head of the Medical Office of the Ministry of Health, Welfare, New Sanitary Investment of the Commonwealth of Dominica. You have the floor.
Other countries as well, or other organizations as well. We've looked at, for example, measures that relates to improving our capacity on island, our strengths and our weaknesses, to see how we can align it in order for us to provide the population with the need to combat the measures to combat the COVID virus pandemic. Fortunately for Dominica, I must say that we have a very strong primary healthcare system, and because of that, we're able to identify or put measures in place in an effort to identify possible cases of the COVID virus. Because of the structure that we have in Dominica, we have a very strong primary healthcare system. We're able to identify, put measures in place to identify persons who may be at risk of contracting the illness as well. Many of our protocols have been approved protocols by the cabinet or the government. For example, we've had protocols as it relates to arriving persons in Dominica, to avoid community transmission. That would include, for example, having certain tests done, and even screening questionnaires as well. Like other countries too, we've looked at medicines, we've looked at other vital equipment that would be necessary as it relates to treatment. So it's quite a bit of protocols that we've looked at in collaboration with some of our sister islands and other organizations as well. As it relates to the vaccine, so we are hopeful to vaccinate a percentage of our population as well. But we're actively looking at ways to combat the illness collectively. Just like I think it was the Republic of Nicaragua that mentioned, the focus is really at the primary care level when we're looking at prevention, focus on the community level with that of prevention. So it's a very fluid situation, but of course, we're working with all of the different team members, we're looking at recent research and working with other established organizations to see how we can continue the fight against the pandemic. So with that, I just wish to thank you for the opportunity.
Thank you. Thank you very much.
While we wait for the representative of St. Kitts and Nevis, minutes just to make some sound check-ins.
That we in St. Vincent and the Grenadines have been implementing a strict protocol in terms of containment of the virus. Our initial efforts were geared at preventing as much as possible the introduction of this virus to St. Vincent and the Grenadines. And that involved the use of strict protocols for visitors coming into St. Vincent and the Grenadines, both by plane and through yachting. We implemented quarantines for persons entering. We also implemented testing of visitors to St. Vincent and the Grenadines. And from the 11th of March 2020 to the end of the year, we gradually revised those protocols to allow for the changing environment in terms of the epidemic, the pandemic outside of St. Vincent and the conditions in St. Vincent. Currently, we have recorded, as of yesterday, we have recorded 540 cases of COVID-19. Up until the 28th of December, we only had about 110 cases, and these were, except for 6 cases that were import related, all of those cases were imported cases. However, on the 28th of December, a patient presented to one of our healthcare facilities with symptoms of COVID, and through contact tracing, we found a cluster of 7 persons at one workplace. After that, we then had a massive increase in the number of cases, and we are now up to, as I said, 540 cases as of last night. Of those, 119 persons have recovered, 419 remain active, and 2 persons have unfortunately died. We had our first death on Friday evening, and the second death was yesterday at 4:30 a.m. Now we are in the process of actively doing our contact tracing, trying to do containment. We have ramped up our flu clinics. We have we have going on 25 admissions between our isolation facility, and we are also utilizing a ward at our main hospital. All of our districts have been activated in terms of, we have assigned 1 clinic in each district to do a flu clinic, where we are seeing persons with signs and symptoms of COVID, and also for the contact tracing testing. And we are leaving the other clinics in those districts to continue with their regular community health programs. We have been using the PCR to do the asymptomatic contact tracing, and we have flu testing. We have also resources to deal with what has been developed to be a significant backlog. And that is definitely impacting our capacity to rapidly isolate persons and identify contacts. We are moving forward in terms of our COVID vaccination plan. We are looking at all of the different options. We have had some discussions with with somebody who is representing the Sputnik V vaccine, and we have great interest in that. We recognize that our major, besides the contact tracing, besides isolation, quarantining, testing, we need to get the vaccine in as quickly as possible. We need to do a safe and effective vaccine program going, because we honestly believe that that is going to be our of this great public health emergency. I'm not sure if my minister would want to say anything else, but that's basically it. Get safe vaccination.
Thank you very much. We have been having some connection difficulties, but let's move forward. I will now give the floor to Anthony Liverpool, the national coordinator of Antigua and Barbuda for Alba TCP. Antigua and Barbuda, you have the floor.
Hello, good afternoon, distinguished coordinators and members of the Alba TCP. Are you hearing me? Hello? Hello? Yes, my mic is off, but I'm... Hello? Yeah. Hello, good afternoon. Are you hearing me? Antigua Barbuda?
Antigua and Barbuda, you have the floor.
Yes, are you hearing me? Thank you. Good afternoon. Are you hearing me? Hello? Yes, my microphone is on, but I'm not being heard.
Antigua and Barbuda with the floor. Antigua and Barbuda with the floor.
Yes, I'm hearing you, but I'm not hearing you. Yes. Hello, are you hearing me?
We are,
okay.
Of course, holding this meeting in all confidentiality. And the idea is to strengthen our capabilities and to work together in order to face the pandemic. Before we continue listening to the rest of the delegations, I would like to give the floor to the Executive President of Alba, Raul Gauci, and explain the bank's potential to address this challenge. And after his participation, in order to dynamize this meeting, we will give the floor to any other delegation. So we will like to ask you some questions in order to take full advantage of this meeting so that we can reach concrete commitments. So having said so, I will give now the floor to the Executive President of the Bank of Alba, Raul Gausi. Good afternoon. First of all, I would like to acknowledge your efforts, and I would like to congratulate you because this is the first time you are moderating a meeting in the midst of this very complex situation. So, distinguished health ministers and authorities, allow me to begin by thanking you for your participation. For us, it is very important to know firsthand what is the situation in your countries and what have been the challenges that you have been facing in the midst of the COVID-19 pandemic. Some countries in Europe are facing the third wave, and we see how figures have been increasingly in many parts of our region. However, we need to acknowledge the work done by our authorities and the decisions made by our governments, because regardless of these threats or challenges, all of us in our countries, we have put in place the necessary measures, and our figures are not as concerning as the figures in the rest of the world. So we need to stay on the alert, and now that we are starting to see the light at the end of a tunnel, we needed to come into an agreement. And in this meeting, what we would like to achieve, distinguished ministers and distinguished secretary, is the way to adopt common measures that will
que
enable
cada uno de
us to
nuestros
attack
países
the new
enfrentan,
viruses.
logísticos,
There are several new
financieros,
challenges facing our
incluso
countries
hasta
today in the
de sus
financial and
regulaciones,
logistic realms.
desde el
And
punto de
also
vista
there
de
were also
médico. No en todos
regulations
los
in
países
terms of
necesariamente
medical
se cumplen los mismos
treatments. Not
protocolos
in
para la
all
aceptación
countries we are
o no
following
de
the
las
same
vacunas. Yo creo
protocols
que
for
me
accepting or
permito
not the vaccines.
hacer,
So
además de mi rol de secretario.
allow me to make some recommendations as the Vice Minister of Venezuela. I would like to suggest that we can identify focal points at the end of this meeting so that we can exchange permanently through the focal points and know what the problems each of our countries are facing. It is important to acknowledge that in the midst of these difficulties, this solidarity needs to be the banner of our nation. So from Alba Bank, we tell you that we stand ready to follow instructions, and we have taken due note of the mandate that the state and government, when they approved the first work plan, post-pandemic first plan in 2021, they have already given some instructions. And I would like to share with you that this is one of the important announcements we wanted to make from the Alba Bank to the region and to Alba, is that we already have the available resources at the Alba Bank that are going to be used in different phases in order to provide financial support needed by the Eastern Caribbean countries who are part of the Bank of Alba, such as Antigua and Barbuda, Dominica, St. Vincent and the Grenadines, Grenada, St. Kitts and Nevis. You can all count on $2 million that are available for different purposes. We are putting at your disposal $1 million non-returnable resources. So this is money that these countries will have at their disposal, all these 5 countries, so they can purchase vaccines in the short term. This is a short-term plan that we have put in place. Right now, we cannot give logistic cooperation, unfortunately, but we are in a position to give financial support, and the negotiations that you have started within your organizations with the pharmaceutical sector, well, you can count on the Alba resources in order to put all those plans into practice. In the middle term, we will also have resources available which are put at your disposal for the vaccines bank and treatment. What is the purpose of the bank? To identify the hurdles and the needs in the region and to make the resources available in a timely manner in the country that requires those resources. Just to give you one example, if someone is going to buy vaccines, a high number of doses and vaccines, well, the Bank of Alba is going to help there and making available the resources for the purchase of those vaccines. And thanks to the relationships that we have with Conviasa, a airlift that is going to facilitate in certain cases by transporting medicines or vaccines to the different countries. Mr. Secretary and dear ministers, I believe that our efforts are going to be oriented in three phases. First, financing for vaccination. Second phase, a vaccination bank that is going to receive the financing of the Bank of Alba. And the third period is while we will start the vaccines production. So we put at the disposal of the member countries these resources, and we stand ready to address any questions or comments. So this is the announcement that I wanted to make today. I don't want to take more of your time. If necessary, I can take the floor again, but I would like to hear from our different countries, to hear the needs that they have. Thank you very much to Raul, the executive president, for the very important announcement that he has made. Apparently we are having some communication problems, sound problems. We're going to try to resolve them, and we will also brief in more direct manner this information to the different countries. The president has made important announcements. This is a positive step for our common work. The first announcement is $1 million, non-reimbursable $1 million for vaccines purchase. This $1 million can be allotted to the vaccines bank or to the banks, and also to use Conviasa as an airlift whenever necessary. It is my understanding that the distinguished representative of Antigua and Barbuda is already online, Anthony Liverpool, he is the national coordinator. I give you the floor.
Must come together to be able to coordinate our efforts, to be able to pool our resources, and to see how best in the post-pandemic period that we can fight this dangerous virus that's affected all of our societies. I have to apologize for the Ministry of Health. They were unable to participate in this afternoon's meeting. However, I will be sharing the details from our meeting this afternoon with them. I just also want to take this opportunity to express our deep gratitude and appreciation for the announcement made by Ambassador Dukausi regarding the provision of support to Eastern Caribbean countries to be able to participate and to be able to obtain the necessary vaccine that will help us in our fight against this deadly pandemic. I think this will go a long way in helping us in Antigua and Barbuda, and particularly in the Eastern Caribbean territories, to deal with this crisis. The latest health statistics coming out of Antigua and Barbuda, that has indicated that to date, we have 190 confirmed cases. We have what we consider 27 active cases in Antigua and Barbuda. To date, we have been able to test over 7,000 individuals in Antigua, and we currently have about 13 persons in government quarantine. And those are just some general statistics about the situation in Antigua and Barbuda. Within the last 4 weeks, we have seen a steady increase in the number of what we call active cases in the country. And therefore, we know that it is an uphill battle, and the kind of support that we can obtain through our Alba alliance, through our Alba coordination, I think that support will go a very long way in helping us to deal with this crisis. So I just want to take this opportunity on behalf of the government of Antigua and Barbuda to express our deep appreciation, and we look forward to continuing our efforts in our attempts to try and rid our countries and our communities of this deadly virus. Thank you very much.
Hello, good afternoon. Simbon Kiza from St. Vincent again. Can I like to make a contribution again? To respond. So St. Vincent and the Grenadines, we have, is that okay? Let's go ahead. St. Vincent and the Grenadines has estimated that we need approximately 70,000 persons immunized in order to get to the recommended level. Sorry? Okay. So St. Vincent and the Grenadines has calculated that we need 70,000 Vincentians immunized against the COVID-19 in order to get the required immunization. And so therefore our interest would be in sufficient vaccines to immunize that number.
Is there someone on the floor now?
St. Vincent and the Grenadines, you hearing me? Hello? Hello?
you very much. It is indeed an honor and a privilege to welcome the Foreign Affairs Minister of the Bolivarian Republic of Venezuela, Jorge Arrias. It is indeed a privilege to have you with us. I would like to inform the results of this meeting with the active participation of various health ministers of our alliance with concrete results. So together, as being our motto, we united fight the pandemic. I'm going to read out these minutes. Regarding the agreements, the creation of a humanitarian fund to create the bank to purchase the vaccines, as agreed in the 18th Summit of the Bolivarian Alliance for the Peoples of Our America, as well as the Medicine Bank to contribute to have better access to health supplies, quick tests, and PCR. And the Executive Secretariat should move forward to coordinate this, to speed up the change of good practices, to fight COVID-19, to exchange experience in dealing with the pandemic based on the measures and other countries, strengthen the participation of the Alba TCP nations in the negotiation processes in order to develop method to purchase jointly vaccines and medicines to treat COVID-19, to foster the more financial and human resources to fight COVID-19 and to promote the transfer of technology and dissemination of scientific and technical information among member countries, to strengthen coordination between the health and higher education for programs of training in the field of the clinic and public health, to strengthen the capacity of the hospital services, insisting on acute respiratory infections, acute respiratory symptoms, and COVID-19. Move forward in the universal and comprehensive coverage of services for the cases of COVID, centered in the early detection, quick diagnostic, immediate lockdown, and treatment in order to control the COVID. To reiterate the need to support the WHO, to stress the importance of having an inventory of public laboratories and biological producers of the region, especially in the Alba TCP nations. And regarding the announcements made by the Alba Bank, given the efforts made by the Caribbean countries and members of the Alliance to address the damage to their economies, a fund has been created through the Alba Bank with $2 million for economic assistance and to improve the well-being of the populations. In the first phase, an initial financing of $1 million non-reimbursable for the Caribbean members, Antigua and Barbuda, Dominica, Grenada, St. Kitts and Nevis, and St. Vincent and Grenadines, so they can reach conclusions or agreements with companies and countries to purchase the vaccines. And second, $1 million for the Vaccine and Medicine Bank to ensure the access to the medical supplies, quick tests, and PCR tests. And the Venezuelan state is open to produce the vaccines, and they are then distributed to the rest of the countries. The creation, establishment of an air bridge through Confianza in order to transfer the vaccines, medical personnel, treatments, medical supplies to benefit these Alba countries. T21. Mr. Foreign Minister, distinguished delegates, these are the conclusions of this meeting. Allow me now to give the floor to Minister Foreign Affairs of the Bolivarian Republic of Venezuela, Mr. Jorge Arreaza, so he can close this important meeting. Minister, you have the floor. Thank you, dear Sacha Laurenti, Executive Secretariat of the Bolivarian Alliance of the Peoples of Our America, Ministers, Minister of Health, Carlos Alvarado, Vice Ministers of the Foreign Ministry of Venezuela, and the rest of the member nations of our Alba Alliance. Thank you very much for taking part in this meeting. After hearing the conclusions, we have achieved the level of conclusion demanded by our heads in our last meeting after a very complicated year. In December 14, President Maduro, Díaz-Canel, Ralph Gonzalez, among others, they were very severe with the team since they wanted to have concrete results. We announced some initiatives, and today they are a reality. The vaccine bank, the medicine bank for the treatment. This is very important because the vaccine has a structural solution, but it takes time. It requires a logistic, production, and transportation. While in other countries, we have moderate, light, and grave cases. So we need to give priority to these cases. And that's the purpose of this treatment bank. The ministers of health have spoken about the exchange and the coordination of protocols of the treatment. What are the antibiotics used, antiviral, the preventive measures, in case of serious cases, how should we deal with those? And the focal points of the various countries, they will continue working on these topics, good practices to address the disease, joint purchases. We thank the Alba Bank and its chair, Raúl Di Causi. They have earmarked funds available. Luckily, this year there were no natural disasters like hurricanes. So these funds are put at the disposal, especially of the Eastern Caribbean region. So in the first phase, they conclude the negotiations, but then to enter joint negotiations with the Russian labs or in the US or in China, a joint negotiation of the governments of our Bolivarian alliance in order to have more opportunities to have the vaccine, better prices, and to purchase more. The first stage, we're going to deal with the health staff, the frontline workers, and then we continue with others. There must be some problems in the country. We could then give more vaccines to those countries and so on. So this is a very good idea to have this joint mechanism to detect early and to diagnose early the situation and in the various stages of the disease how we need to address this and save lives. In our hemisphere, in Venezuela, Cuba, Nicaragua, with mortality rates low, this has been possible thanks to protocols that should be analyzed and shared, not only among the Alba TCP, we also need to share this with other friends of the Caribbean and South America. We are willing to join efforts with them in these coordinations and treatments. So, this air bridge with Conviasa, but there are other airlines in the Caribbean that could help us, and even the private sector, if they have, there is a surge, outbreak in one island, and they need supplies, respirators that we have in Cuba, Nicaragua, Venezuela, we can resort to those planes together with the health personnel. We are also willing to provide training in the case of the protocols for non-invasive respiratory assistance, which is easier to use. It does not require so many equipment, and experts in Venezuela have been trained to assist South American countries and the Caribbean countries in these fields. As the Executive Secretary has announced, they will be responsible to coordinate these initiatives, these medicine and vaccine banks. But all countries through the Secretariat should act together, and the focal point should ensure the implementation. So we need to sit down with the labs and stay producing the vaccine as a group. This is an alliance premised on complementarity and solidarity, the principles of unity, which are essential. Our reference is Simon Bolivar, Fidel Castro, Hugo Chavez. Those are the reference, Che Guevara. Our capacities should be put forward, as Bolivar said, to generate the system of government, a multilateral system of government to provide the highest sum of joy, happiness to our people. President Maduro spoke to me a while ago. He's very attentive to the results. Well, this has been created with structured financing. We need to implement it as soon as possible so we can give results very soon. On behalf of President Maduro, I want to congratulate the Executive Secretariat, its teams, the teams of the foreign ministries and the health ministry, which have participated in this emergency meeting convened last week. So let's continue addressing this pandemic to strengthen our coordinations and our health system. Thank you very much. Thank you very much. Thank you all.